Hello, everyone. My name is Tanea, and I am one of the administrators for Future Minority Dentists. And tonight we're going to be having a specialty spotlight discussion on pediatric dentistry. Today we have two people joining us. We have Dr. Simon and Dr. Addison. So if you guys would just unmute yourselves and introduce yourselves to everyone, and then we can get started.
All right. Can you guys hear me okay?
Yes.
Okay, awesome. Well, my name is Dr. Jessica Simon. I am from Brooklyn, New York. I went to dental school at Case Western School of Dental Medicine in Cleveland, Ohio. And then I did my pediatric dental residency at Long Island Jewish Medical Center, Cohen's Children's, and that is in New York City. And then right now, my husband and I and my family, we reside in Charlotte, North Carolina, where I practice.
That is awesome. Hello, everyone. My name is Dr. Taylor Addison. I'm originally from New Orleans, Louisiana. I went to LSU for undergrad, and then I went to Meharry Medical College for dental school in Nashville, Tennessee. And now I'm currently a second-year pediatric dental resident at UCLA.
Awesome. I'm so happy to have both of you guys here today, and I'm very excited for this conversation. So I'm just going to start with questions. So for everyone in the audience, I do have a list of questions to ask the speakers. If at any point you have a question you would like to ask yourself, just raise your hand, and I'll bring you to the stage where you can ask your question. But there will also be time to ask your questions at the end of the call. So the first question I'm going to pose to you guys is, when did you know that pediatric dentistry was for you? And did you go into dental school knowing that's what you wanted to do?
Okay, so what I would say in college, so I went to University of Rochester. I forgot to say that, but I went to University of Rochester, upstate New York, and I had the opportunity. It was the summer before my junior year. I had the opportunity to go to Malawi, Africa, which is Southeast Africa, and we basically can decide what we wanted to teach um, the small villages, teach them about HIV, malaria, different things. And so a lot of people were actually
I think we lost your audio, Dr. Simon.
I guess I can go ahead and go until she comes back on. But for me, can you guys hear me?
Yes, we can hear you.
Okay.
Can you guys hear me okay?
We can hear you now, yes.
Oh, I'm so sorry. So yeah, they speak the language of Chichewa. And so, we had a
Oh. Our connection keeps going out. Okay, Dr. Addison, you can go, and then Dr. Simon can just go after.
Okay, I'll make it really quick. So for me, when I entered dental school, I had no idea if I wanted to specialize or, I went in with the thoughts of, like, I want to be a dentist. That's been, my goal since I decided in high school. But when I got to dental school and started to explore different specialties, I'm not going to lie, I felt like at one point I was interested in process when we first started learning how to cut crowns. I'm like, okay, this is cool. And then I also feel like when you go into dental school, like for me at my school, my year, I graduated in 2019, but like ortho was the hype. So everyone wanted to do ortho. So I was thinking, maybe I might be interested in this. I'm not really sure, but I entered pretty much with an open mind and just tried to do my best from day one. So that way my grades wouldn't be a reason to stop me from getting into any specialty that I wanted. But it wasn't until I did a mission trip to Jamaica going into my junior year when I figured out, okay, this pediatrics thing, this is me. I feel like it was the first time that I did something in dentistry where it just felt like it just fit, and I felt like going into your third year, you get more clinical experience. So it wasn't like I had all the pedo experience, but it came to me very quickly. Just being able to communicate and connect with kids came to me very easily. So I just kind of had that like aha moment on the mission trip. Like, this is me. This feels good. This feels right, and I think this is what I'm supposed to be doing.
Can you guys hear me okay now? I'm so sorry about that.
Yeah, we can hear you now. It's okay.
Okay, I had to go to a different room. Sorry about that. So, like I was saying, I did a mission trip in Malawi, Africa, and they knew nothing about dentistry. And, I was like, okay, it kind of piqued my interest. And so then when I came back to the States, I realized that the same issues that were going on in Africa were going on right in my neighborhood, where families just lack of access to care, not understanding the importance of oral health care. And so I decided to go to local schools with obviously some mentors that I had, and just started volunteering. And I realized, like, this is what I want to do. I'm like, I want to be a pediatric dentist. The kids were amazing, and I was just like, this is my passion. Like, honestly, I felt like, now when I got to dental school, I felt like, oh, working with adults was just not for me, and so I was just like, this is what I'm going to pursue. So when I got to dental school, I knew that this is what I wanted to do. So that's why I chose the dental school that I went to, Case Western, because first year they had a sealant program for first year dental students. So after Thanksgiving, you come back and you're literally just going to schools in the inner city and just doing sealants on, schools, kids in public schools, which I was like, okay, this is the dental school that I want to go to. So I know it's a little unusual because some people go into dental school not knowing exactly what they want to do. They're open. And I would say be open, but, if you really know for sure what you want to do, like, press forward and do that.
Okay, thank you guys for sharing that. The second question was, when did you apply for residency, and how was that process?
I guess I'll go. So the first application deadline was August 15th, as I remembered. It was like 2 years ago. So, but I would like, my advice would be to start that spring going into your fourth year, preparing, getting everything together as far as like talking to the professors, kind of filling out who you're going to ask for your letters of recommendation, making sure your CV is together. Also making sure like you go ahead and start writing your personal statement, because once the application opens up, which I believe, y'all don't quote me on this, I believe it opens up in May. When the portal site opens, you just, it's like copy and paste and uploading things from your CV. But what I've realized for me, like with the bottleneck of submitting my applications, were my letters of recommendation, getting the professors and attendings to go ahead and write everything out. So if you kind of prepare and plan that spring semester going into your fourth year, then once the portal opens up, it'll be easy, just kind of copy and pasting your information in different little sites.
So I am just going to piggyback off of what Dr. Taylor just said. So I agree completely. Like, she is right that the past application, it does open up May. I actually looked it up before this, and I think it's May 15th. So that's when it opens up, and I completely agree with everything she said. Making sure that you are just on top of everything. I was actually I think me and my other friend were one of the first people to go to professors, like, can you write my letter of recommendation? Because when everybody comes back and they start flooding and asking all these teachers, like, you don't want to get caught up in that where it delays your application. So I would just say, definitely be on top of it, making sure that you're working on your personal statement, because that's a big factor I would say that programs look at. and also your letter of recommendation. So making sure that that you do have mentors, that you do have people that can write something really well about you, that know you really well.
Yeah, I totally agree. I just wanted to add one more thing that just came to me about the letters of recommendation. So, and I didn't know this until I'm now like on the other side as a resident. We do take place in the interviews for incoming residents. The letter of recommendation isn't just them writing something about you. It's kind of like a auto-filled like portal site where they have to answer certain questions, and like some of the questions are like, how well do you know this applicant, how long have you been knowing this applicant, how would you rate them on this scale when it comes to, I don't know, responsibility, things like that. So you want to really make sure that the person that you ask, that they know you, also that you can provide them a copy of your CV, so they have things from your CV to pull from to write you a favorable letter. I think that is really important when you go to ask someone, you come prepared with your CV and you ask them to write you a favorable letter, because I mean anybody can write a letter just to have it done, but you want someone that can speak very, very highly of you, because letters of recommendation are one of the biggest things that I know for us at UCLA that we look at to see, okay, what does this person say, or think about this student? Because the pedo world is very small. Like everybody knows everyone. A lot of these attendings were either co-residents with some of the other program directors, or um, you know, were underneath another program director. So the world is very small, and a lot of, I would say, like giants in the pedo world. If you have someone who writes you a letter of recommendation and comes from them, then it'll weigh really heavily. So, yeah.
Okay, so basically your letter of recommendation, your CV, and your personal statement. Is there like a exam you have to take per se to apply to pediatric residency?
Not anymore. At one point, they were requiring applicants to take the ADAT, and that kind of phased out my year. But no, not from my knowledge.
Okay, perfect. What qualities do you think like residency programs are looking for in like a really good resident to choose to be in their program?
I could go ahead and start with this one. So, what I would say is that they really want people to be, that they see that are proactive, that on their CV that they have did a lot of volunteering with children, that a lot of community service that they've seen. Ultimately, I mean, because we were also a part of the interview process when we had incoming residents come in, and they really just want to see people that are really passionate about pediatric dentistry. I mean, pediatric dentistry, I think, along with ortho, it's just like a hype. It's like, for a lot of people, like, oh, I want to, they come in, they're like, I want to do ortho, I want to do peds, but they really want to see that you're passionate about it. They want to see that, that this is what you really, really want to do. That's what we strive for. We wanted to see people that were well rounded, that even outside of, you wanted to do pediatric dentistry, like, what are you about? What sets you apart from everyone else? And I think that's one of the main things for me.
I totally agree with you, Dr. Jessica. You said it perfectly. What are you about, like outside of the workplace? That's super important. As a resident, being a part of 2 interview cycles, I have noticed the residents that end up being ranked, highly ranked amongst us, is the fact that they are very personable. They are themselves. They aren't trying to kind of be something that they're not. And I feel like in interviews, you can really pick up on that. At the end of the day, if you get an interview, you are qualified. So at that point, it's just seeing if you are a good fit for the program. for us, I would say. But also, I think it's super important to make sure that when you are going into residency, you understand that a lot of these residency programs are resident driven. So you definitely have to be hardworking and organized and being able to kind of just kind of handle things and realize that it's not like dental school where everything is structured for you and organized. Like you are going to be the one sometimes kind of organizing like for instance at UCLA we have different like chief roles. Like we don't just have like one chief. So for me, my chief role is organizing all of our IV cases for and oral conscious sedation cases for all of my co-residents. So just being able to be organized, hardworking, and definitely a team player. I think those are very good qualities that pretty much all programs will be looking for.
So I wanted to add to that a little bit, and she pretty much nailed it right on the head. Like that's exactly right. A lot of things also that I believe that they are looking for to piggyback is leadership qualities. They want to see that you can be a good leader because it's really not that many residents, right? So they want to make sure that you have leadership qualities. If they give you a task to do that, you can do it, that you are not, they don't need to spoon feed you. Like they give you this and you figure it out, how to do it. Also, I think another big thing is pretty much being like having self-awareness and commitment to improvement. Like, they want to be able, because they want to see that you're teachable. They don't want someone that's like that they know it all, like that is willing to learn and be like, okay, I did it this way, but let's try it this way. This way may be better. Like they just want to see that. And I think that's really important too. It's great to know who you are and the things that you are great at, but it's always a great thing to just be open.
I could not agree more with the teachable point. Like, you have to realize, like, if you knew everything about whichever field you decide to go into, or if you knew everything about pediatric dentistry, there would be no reason to do a residency. So you have to realize that, you know, you don't know everything. There are multiple ways of doing things. So being teachable will get you so far in life in general, but especially in residency.
Okay, I imagine that if you're interested in some kind of specialty in dental school, that it's recommended you get involved early. So what advice would you have for like a first or second year dental student that is interested in a certain specialty and they are seriously considering doing that once they graduate?
So what I would say is that if you're really interested, your first year, second year dental student, um, I would say really focus on, community service. And I know a lot of people are like, okay, like, yeah, I'm gonna give kids a smile and do a lot of dental related things with children. But honestly, for me, what I did, like, I was just like, okay, want to I just want to volunteer. So I would call like local churches, I would call preschools, just, like, hey, like, we really want to talk to the kids about, oral health, or we just want to just talk to the kids and just mentor them. Like, just whatever. Like, I just really wanted to be around children. I'm like, okay, because it really was a passion for me. So, let's say, for example, you don't have like a pedo club at your school. You can create one. You can talk to, the local staff at the school and just, try to start one. I became the president of my SNDA chapter at my school because it wasn't around for so many years, and I'm like, I want to do this. So I kind of started it back up, and then it became this big thing, which is great. And so I think it's about being proactive, you know, um, Also, another great thing is doing externships. I know since COVID, I think they're doing it virtually now, I heard. But just contacting programs, like just showing that you are really interested, and so that you have a lot of things to put on your resume. Another thing is to just seek out mentors. Um, I just was like, oh, I like what this person is about. Like, I would just reach out to people and email them. But now with social media, I think it makes it so much easier to do. So that it just leaves it so open for you, for you guys to just, really dive in and really, create what you want.
I definitely agree with that. I think that if just thinking about first and second year of dental school, it's very, very important to make sure like you keep your grades up. So when the opportunity does come for you to decide if you want to go to pedo, it's kind of you don't have to worry about, oh, is my GPA high enough, or so that's one thing that I always just try to keep in mind. But also I definitely agree when Dr. Jessica was saying about getting involved, and even if it isn't pedo related, but just getting involved in community service definitely shows that what type of person you are, that you are caring, that you care about others. And I think that's a big quality that I think majority, or not if all pediatric dentists have that quality of just truly, genuinely, being a caring person. Um, Outside of that, I would say first and second year, maybe you can get more involved with, if your school does have a pedo program, um, or pedo clinic where they just see kids, just kind of maybe seeing if there is a little bit, anything that you can do, shadowing experiences, just getting more exposure to the field will definitely help you. One, if you are on the fence of deciding if that's what you want to do, or kind of further confirm and get you a little bit more inspired. Like I remember for me, when I would go home on breaks, there was a pediatric dentist that I would shadow sometimes, and those opportunities that I had to shadow her really inspired me to just keep going. Like, yes, this is what I want to do, and I think it's super important, especially the first 2 years of dental school. It's hard, like trying to get acclimated to everything, trying to juggle all the different courses. So, staying, inspired and focusing on, your ultimate goal that's going to help you see it and achieve it.
Awesome. Thank you, guys. Our next question would be, what's your favorite or your most favorite and least favorite thing about pediatric dentistry?
So what I would say is my favorite is, you have that kid come in, they're scared, they're hiding behind mom's leg, or they're crying and they just want no parts of coming in, and they're fearful for whatever reason. Um, and then pretty much like just calming them down, using like, techniques that we learn, to get the patient to ultimately trust you, and just changing the whole appointment around to the point where they love coming to the dentist. Like I like seeing, from that very first appointment where they're like crying and they're afraid to, then appointments later where they're just love coming. They're like, like, Dr. Simon, I love you. Like, it melts my heart. It makes me so happy that, this kid now loves brushing their teeth. The parent is on board. I educated the parents, so now they understand. And I'm like, that ultimately is what I strive for, um, in the field. Um, my least favorite, I mean, I guess if I had to choose something, it would be, the parent that kind of wants to pick and choose what they want for their child. So like, you came to see me, as a specialist, like you came to see me, but it's the parent that doesn't want the fluoride, that, just, doesn't really want to take the recommendations I have, but then the child has all these cavities, and they're like, but I don't know how they got them. And, you try to educate, but, they're still trying to pick and choose what they want to do. I guess that's a little frustrating, but, I think you take the good and the bad. I mean, and ultimately, what I've learned is that you can't take that home with you. It's just like, okay, at the end of the day, they are the parent. You can give your advice. You document what you recommended. And that's all you really can do. I used to take those stresses home, and be bothered by it. But you just kind of have to let it go. And then hopefully, as they come more and more, that, they change.
I am definitely in agreement with the parents, starting with the least favorite. Not all parents. Like, let me preface with saying that not all parents. You'll really have some parents that'll be on your side and, really back you up when you want to suggest changes to the kids. So I appreciate those types of parents, but I think that it wasn't until coming into residency I realized part of pediatric dentistry really is managing pretty much two patients at once. So you have the child in the chair, you're trying to manage them and focus on them and of their needs, but then sometimes you do have the parents that, either want to stand over your shoulder and watch, or, want to kind of make it a bad appointment before you even come in, saying, oh, they don't give you a shot if you don't, stop crying or something like that. So just learning how to manage different types of parents can definitely be a challenge in pediatric dentistry. And I feel like I had to learn that real quick in residency. But I would say one of my favorite things about pediatric dentistry is really making those connections with kids. For me, I've noticed that especially during this COVID time, they don't really have that many, interactions with people. So just to have them come in and then be an outlet for them and talk about, their day and what's going on in their lives and be all about them. Because of obviously of today's climate, but then also a lot of kids, they are at home with like multiple siblings and things just aren't about them all the time. But I think that's one of my favorite things, just talking to my patients, getting all in their business. Like, my patients are like my little friends. Like, they tell me everything. They give me the rundown, how, their little sister don't brush their teeth, but they do, and they like, it's really, I really do enjoy having those conversations and being able to be an outlet for kids, and also, being able to kind of shape them in a positive way. Being in my profession and being someone that's an adult and has that authority figure, but also someone that is willing to listen to them and allow them to express how they feel, because a lot of kids don't have that. So
Perfect. I really like that. So right now, I work as a surgical assistant for an oral surgeon, and there's not really many pediatric offices nearby where I work. So a lot of times we get a lot of pediatric patients, and I agree. Like, the parents sometimes, they're like insane, and they make your job so much more difficult sometimes. But then some of them actually make it easier. So I do feel you guys on the part with the parents.
and there was one more thing I wanted to say about the parents too, because to a certain extent, I'm not a parent, and I know I probably will think totally different when I have my own little babies, but that's something that I try to hold on to. Like, these are their little babies. Like, they take care of them, they love them, they're protective over them. So sometimes I can't really take it to heart that they're, against what I think may be best, and they want to do something. Like, at the end of the day, that's mom, that's dad. They, make the ultimate decision. I feel like that was something that I definitely had to learn and add to my toolbox of dealing with parents.
You know what? So one thing I would say, I do think I became a better pediatric dentist once I had children. I do. Because I feel like before I had kids, I'm like, why don't they just want to listen to my treatment plan? Like, it's not that serious, But after I became a parent, I was like, oh, because I have a 3-year-old and a 7-month-old. And so I completely get it. I'm like, I put myself in their shoes. I'm like, they don't know dentistry how I know dentistry. To me, that I'm gonna do a class 2 restoration, like it's simple in my mind, right? But this parent does not know anything. They're just like, what are you gonna do with my kid? What is that thing you're putting on their nose? They like, they want to know everything. So I think that's where my ultimate patience comes from. I'm like, okay, they don't know. So then I have to literally explain everything. And I'm okay with it. Before, I guess I would explain it, but it would be to me, I guess, a little of some annoyance, I guess, like, but now it just comes from a different place because I am a parent.
My next question that I have is, what has your experience been with establishing a work-life balance?
I can go and talk about that. So, it's so funny that, just for example, like today, my daughter's school called and she had a fever, and I had to go pick her up. I was the only provider in the office, and I was trying to honestly figure out a way where I can stay in the office and see my patients, but ultimately I had to reschedule everyone, just to go and take care of my daughter. And so, I think it's about really taking, and that was just one prime example, but what I would just say is that when you are at work, give 100% at work each time. Be present for your patients all the time, and then once you leave work, that is your time. I would say don't bring the stresses of work home with you. Try to get all your work done while you are at work. Um, for me, now that I have 2 kids and trying to juggle, family life with working, because my husband's a general dentist, so he's a dentist as well. So, just trying to juggle all of that with children, it's tough. I'm not gonna lie, especially like you do want to. A lot of people want to, as a mom, like as a woman, just start a family, have children, and so I think it's important to also, like, obviously you care so much about your patients, but you also need to choose yourself, and I know sometimes it's hard, and I know sometimes some people feel bad, but and that's what I had to learn. I would bend over backwards for my patients, but at some point, you have to choose yourself, and take that time to do what makes you happy outside of work. Because, ultimately, yes, we love our profession, but that's not all you are, right? That's not everything.
I totally agree. Completely agree. I'm gonna be honest with y'all. Like, I'm still trying to figure out work-life balance, especially as being a resident, because it's like they can pull you at any minute to go do this or do that, or being on call and things like that. But so I have not perfected it yet, to be honest. But I would say that what I started to do recently was to think about every day. Okay, Taylor, what did you do for you today? And I'm like, oh, I really didn't do anything for me today. Okay, well, let me, you know, carve out time, plan time to do something for me every day. Like, whether it's something small, like, okay, I'm gonna watch one of my favorite like trash TV shows or something, or because I do like trash TV, y'all, it's a guilty pleasure. But like, or if it's or make like a nice dinner or something like that, instead of just getting something to go from the hospital, or just doing little things that I'm like, this is intentionally something I'm doing for me. I'll work out, do a quick little 30-minute something, just doing something that I can say every day, okay, I did this for me. This wasn't for someone else or for something else. So that's how I try to balance it out, but I'm still working on it.
Alrighty, and my last question. Oh wait, Dr. Simon, did you have something you wanted to say?
Yes, I did. Thanks. So another thing that I wanted to add is that joining groups on Facebook. I know the world of social media. It's so great because like, for example, I'm a part of like a mommy dentist group, where we can kind of vent and kind of talk to each other about just whatever, like dental related, non-dental related. Like, there's so many different groups out there, to give you support, because I think, just in this profession, like, we need to support each other. So I think that's also important too. So that is an outlet as well.
Alrighty. At this point, I want to open up the floor. If anyone in the audience has anything they would like to add, just please raise your hand and I'll bring you to the stage. In the meantime, I'm going to ask the last question that I have, which is, are there any limitations on what you can do as a pediatric dentist?
So what I think the cool thing about pediatric dentistry is that, so typically we see children from like infant to typically some people do 18, some people do up to 21, but I think that with pediatric dentistry, ultimately you can do, I think, everything in the scope of pediatric dentistry if you feel comfortable. Um, so let's say, there's obviously general things that you are the specialist that you have to do, right? Because there's going to be people that send, children to you from general dentists, obviously doing restorations, doing space maintainers, things like that. But let's say, for example, you have, a child has an extra tooth that needs to be extracted. Some people may, and let's say like you have to make a flap and extract the tooth. Some pediatric dentists may not feel comfortable doing a flap and taking it out, so they'll send it to oral surgery. Like things like that. Or, I guess like for me, if I really feel like this is beyond my scope, then I do not do. I have a really good friend that's a pediatric dentist that, in my in my pediatric dental residency, we did ortho twice a week, which a lot of programs don't do. But she got really comfortable doing some simple ortho cases and, just phase 1 ortho, and she does it. And for me, I don't do that at all. So it's kind of like, I guess where you feel comfortable, like you have to know where to draw the line.
Yeah, I totally agree, Dr. Jessica. You pretty much covered all the points. I really don't have much to add, but I would definitely agree. It's the same wherever you feel comfortable under the scope of what we've learned. It's pretty much what we can do. We're kind of like the dentist for kids, so we can do a lot.
All right. Does anyone in the audience have any questions? Oh, I got someone raising their hand. Hi, Travis.
Hello, hi guys.
How are you?
I love the sharing.
Hello.
Thanks for having me in the group. I just had like a question, a general question. A couple years ago, about 3 years ago, I worked with, I don't know if you guys know Carrie Haas. She's the largest pediatric dental practice down in San Diego. They got about 150,000 pediatric patients. And we built them a rewards platform. It was a little piece of software, and it didn't ever go anywhere. We started to build it. We put about $100,000 into building it together, and then it just kind of stopped because of they felt like maybe the ADA was pushing back on rewards. I just had a question. I'm sorry I know this is a sharing, but I'm just curious. Maybe this is something that everybody could benefit from too. Do you guys have any experience in doing like rewards platforms to help like entice the patients and to get the parents more involved and engaged and things like that, and any kind of toothbrushes, something like that you integrate? Do you guys have like a giveaway that you give to kids or something like that to reward them for good oral health?
So at my office now, what we do, it's not actually too much, but what we do giveaways sometimes. But I guess it's just to get, more new patients in the door kind of thing. But typically what we do, we have like a no cavity tree. So we take their picture. They get to, we put their picture on the wall, obviously with the parents' consent. They have to sign a form and just say, just putting the picture on the wall. It's this huge tree. And, we just put their picture on the wall so that when the child comes, they're excited. They're like, Mom, look at my picture. And that's what what we typically do. But there's no, us, giving things away. We give, every time they come for a recall, we give them a goodie bag every single time. So, and give them, little prizes and things like that every time they come. So, in terms of, a reward program, we don't do.
Do you have a view against it, you think, or is that kind of maybe what happened, you think?
I don't know if I think they just, I don't know if they even thought about it, honestly. I don't know if they're against it. I don't really see a huge issue with it, to be honest. I don't see what the pushback would be.
Okay, thank you, appreciate it. Anybody else have any rewards platforms that they do, or programs with pediatric dentists? I know a lot of these people you guys are students, so it seems like a great group. So appreciate the input. Thanks, guys.
You're welcome. Does anyone else have any questions or comments they would like to add at this time? If so, please raise your hand. I can bring you to the stage before I bring the room to a close.
There is one thing that I wanted to say too. When looking at programs, it's really important to look at what type of program you are looking for, because some residency programs are hospital-based and some are school-based. So you have to decide what you're actually looking for. There's some programs that are really research-based, is really heavy in research, and other programs are really clinically based, like more hospital-based programs. For me, I wanted to choose a hospital-based program because honestly, I didn't want to be in residency taking a whole bunch of classes anymore. I was so honestly done with, doing that in dental school that I wanted to be more efficient with my clinical skills, and also with a lot of patient management skills, like how to really manage the child while they come. And so, yeah, definitely think about what type of program you're looking for when applying.
How would you go about choosing what's best for you? I know you said you didn't want to do any more classes, so that's why you went for hospital, but who would go for a research program?
You just have to know what you're looking for. So I would go on the AAPD website and look at all the whatever area in the country you are interested in, and look at the programs in that area, and just look at what they focus on. And you have to know what, for me, I did research because we had to do it, but it wasn't something that I was passionate about, and a lot of people that I know that also did research really wanted to teach. They wanted to be adjunct faculty at a school or something like that. That really wasn't my passion within the field. So just knowing, and I think you'll figure out what you want to do in the field of pediatric dentistry once you volunteer, once you do externships, once you'll get a feel of, okay, this is not what I want. Or yeah, I like this. This is what I want to do. This is, so I think just getting more involved, especially I know Dr. Taylor was saying that she shadowed someone in her area. So just, getting more involved, and then you'll map out and know exactly which direction you want to go.
Yeah, I totally agree. And just to piggyback, I think that externships are super important, in my opinion, when deciding to choose a residency or reaching out, like especially through social media, reaching out to residents that you know already there, that you see there at the program. Because what you'll realize if you look online, you'll see that a lot of the things that, oh, this program does this and this program also does this. Well, there are quota requirements that all programs have to fulfill in order to, give a certificate for pediatric dentistry. But like Dr. Jessica was saying, that some of them are more university based, some of them are more hospital based. For example, UCLA is considered a combined program where it's like half hospital based, half university based. So I think that's also a good option if you are unsure of where you kind of want to go, or if you see yourself going straight to private practice, or if you see yourself in I'm sorry, I'm getting a phone call in the middle of this. I'm sorry. Or if you do see yourself in academia after residency, but definitely reaching out to residents and doing externships, even if it's virtual externships, that'll give you an idea of how that program is ran and what they're really doing. For me, the reason why I decided to choose a combined is because I do feel like what I've learned in this program is that there's a lot of information about pediatric dentistry that you just don't learn in dental school. You get in kind of, touching all of the different specialties, but there's so much more to pediatric dentistry that I'm sure you can get from residency. But for me, the type of person I am, I also like to know more of the why I'm using this, why I'm doing this, because what I've realized, the more prepared that I am when I have like those parents that are trying to like come for me or just trying to like check me, ask me a bunch of questions, like I'm ready and prepared. I know the why, the how, the if, the what, the risks, the benefits. So for me, that was one of the main reasons why I decided to go into a combined program.
Okay, thank you.
I did want to say something.
Okay.
I just want to commend the doctors on stage. Y'all did an awesome job explaining about pediatric dentistry. And I did want to say, I think this is a little point, that this specialty has the most, compared to all the other specialties, endodontics, oral surgery, has the most black women actually practicing in this specialty than all the other specialties in dentistry, which I found that to be just when I wrote my book about 6 years ago, and I did some research, and I found out that there's a lot of black women in pediatric dentistry compared to some of the other specialties. So I just want to commend y'all for doing such a great job. I just wish that, that we had a lot of more people that would come and listen to what you have to, the knowledge that you were giving, because I listened to everything, and I think I just want to commend both of you all for doing such a great job.
Thank you. I really appreciate it.
Appreciate it so much. Thank you. What book did you write? What's the name of your book?
It's called Black Women Dentists. It's on Kindle now. Yeah, it's on Kindle now, but it was years ago, about 6 years ago, I wrote this book, and I interviewed like 14 black women dentists across the country, and we had 2 pediatric women, pedodontists in the book, and that's when I was able to get those numbers and found out that, there's a lot of black women. Well, compared to, there's not a lot of black dentists. You understand that. I mean, we're less than 7%. 4%. So there's roughly 7,000 actively practicing black dentists in the United States right now. And then the number comes really smaller when it comes to black women. But in regards to all the other specialties, at that time, which was 6 years ago, there was only 20 black women that were oral surgeons, and most of them came through Howard Oral Surgery School. So it's 20 oral surgeons. I think it's more now, but back then, which was only 6 years ago, that's all that we could actually kind of pinpoint. And they all had, what they had in common was Howard. So they went through Howard's program. I think Meharry, which I'm an alumni. Harry also has a program too. But at that time, mostly everybody who was black woman that was an oral surgeon went through Howard. And we were also able to get information. We found out that in all the specialties that there was a lot of black women who were pedodontists, which I was so happy to hear that compared to all the other specialties.
Thank you. That's awesome. So I'm actually going to look into that. Look into your book, and I know it's a couple years ago, but yeah, I definitely want to read it.
Yeah, you can. It's on Kindle. You can read it.
Okay, awesome.
Yeah, but y'all did a good job. I just wish we had more people that would come and listen, because you imparted some pearls that they really need. In regards to, one thing I did want to ask you all to talk about the competition and how it's very competitive, especially now. We're trying to get into specialty school, like orthodontics and all those. I mean, very hard to get in, and about the competition that it takes to actually get into pedo school. I mean, it's very competitive.
Yeah, I would say that, I think pedo, ortho, oral surgery, I think those are, I think the ones that people really want to do. It is competitive, but I think if people listen, at the end of the day, I feel like if you are really passionate about something, it will show through. Obviously grades, board scores, things like that are important. But, it's more than that, and I think if you are really passionate about something, I think it shines through and it shows. And let's say for some reason someone does not get in the first time. I know a couple of people that decided to work as a general dentist, to focus on kids and see kids, get that experience, and then reapply, or some people just was like, okay, well, I'm going to do a GPR and then reapply again. So, definitely if, someone did not get in the first time, I will say, obviously, keep pushing, keep trying, like, do not give up, and, you will succeed. You will, you just have to keep going.
Yeah, I agree. I have realized that it's become super competitive. Just being a part of the interview process and reviewing applications. But we do try to, I would say, for UCLA, try to look beyond what's on paper and see, okay, what are they involved in? What do people, have to say about them that speak highly of them? So, you're true. If you are true, genuine, doing the right thing, that'll definitely shine through, because there have been applicants each year where some of them are on their multiple attempt and get in, or some of them, were working as a general dentist or did a GPR. I would say, I can only speak for UCLA right now since I'm here, but we do take like a variety of applicants. Some, straight from dental school, not all. I would say this year it was about half and half. Half were practicing. Some were practicing for a couple of years. And then some came straight from dental school. So there's no one direct path to pediatric dentistry, but I definitely agree with Dr. Jessica. If you don't, get in on your first try, do not give up. I'm a firm believer in everything happens for a reason. So, just keep trying and stay motivated and stay inspired, because I do think this is the best specialty. Like, I'm biased, but it's so rewarding and fulfilling. And, when it doesn't feel like work all the time, I feel like that's how like you are in the right field and profession.
I love this. I'm so excited.
Good. So there's actually one thing that I wanted to talk about. It's a little bit off topic, but I think it's important for people to know. If you are a pre-dent or in your first year of dental school, I think, obviously, school is super expensive, especially now, the tuition and fees and everything goes higher and higher. I do think that people should look into the National Health Service Corps Scholarship. I am a scholarship recipient, and it was such a blessing for me. They pay for every single thing. It's a government scholarship. You have to apply before dental school or within your first year of dental school. And it's either a 4-year or a 3-year commitment after you graduate. And what's great about the scholarship is that pediatrics is the only specialty that you can defer. You can defer and then do your commitment. So they paid for everything for dental school for me. I was able to defer it and then do my residency for 2 years. And then once I graduated from my residency program, then I was able to do my 4-year commitment. And the reason that it's just only like pedo, obviously, or, if you're doing general, is because obviously, ortho, oral surgery, like those are specialty programs that, can't really cater to patients like in rural areas or inner city areas, because obviously there's a huge need for obviously children. So I just wanted to point that out to you guys. It's called the National Health Service Corps Scholarship, and it really is an amazing scholarship. I really have no complaints about it now that I did my service and now I'm in private practice, but just something to look into.
Yeah, I think we had a discussion about that. Was it? It was about maybe 2 Fridays ago. I think we talked about it, or a couple of Fridays ago, about National Health Service Corps. I actually did. I was in the public health service, United States Public Health Service, for a few years. So definitely National Health Service Corps is one of the best deals to get if you can get it. But one of my mentees was able to get it last year, and my other mentee is up for it now. So it is very good thing to get involved in, because it does allow you to practice in an underserved area and actually help with the disparities and access to care that occurs in rural and urban cities.
Alrighty. Does anyone else have anything they would like to add? If so, please raise your hand at this moment.
Hi, this is Alicia. First of all, thank you for the great program, and I love pediatric dentistry, so this is wonderful. How important, what is the generally accepted GPA that pediatric programs for?
Taylor, do you want to answer? Because I feel like it's been a couple of years for me.
Yeah, sure. Okay, so I think that it definitely depends on the program. Like I said, UCLA, they definitely look at, grades and your letters of recommendation and how, your application is put together. But I would say, from what I've seen, some of my other friends and some of the applicants, don't quote me, but I think 3.0 is very solid to guarantee you an interview somewhere. I think that's a very solid and safe GPA. Obviously, higher, you should be fine. But like I said, there are other things that can, get in the way of you getting an interview. If you get an interview, that means you're qualified, and it's just about the perfect fit. Because with the match, it's you are also the prize too. Programs need residents to run them. So, you have to make sure that this is something that you want, a program that you will want to be at, and then the program also, has to fit. It has to be a good fit. Both parties have to agree on if this is the right place for you to be. So, I guess to stick to the main question, 3.0, and this is just based off my experience at UCLA. However, I do know there are multiple people that did not have a 3.0. I think maybe the lowest I have heard of was maybe like a 2.5, and still, getting into a program. However, I'm sure there were other things that, clearly shined on their application, and I think, like, especially letters of recommendation, those go a long way. If you can have someone, really vouch for you on your character and who you are in your performance, because sometimes, a lot of times grades aren't everything. Just because you have the highest, GPA, that doesn't mean that you're going to be the best pediatric dentist. Like, dentist, are you, compassionate? Are you genuine? Can you, really relate and understand kids and talk to people? Do you know how to talk to people? So I would just, kind of keep the GPA. If you need a number, I would say shoot for a 3.0 if you need a number, but understand that there are different things that can tip the scale either way.
So I want to add to that. I completely agree. So I would say that grades are important, but like Dr. Taylor said, not everything, right? I firmly believe the reason that I got into my residency program is because of my mentor. My mentor actually happened to be really good friends, and I didn't know this. I had no idea. But apparently, she went to dental school with the program director, and she wrote me an amazing letter of recommendation. And I really believe, he was just like, during my interview, he was like, oh my God, he was like, we went to dental school together. I was like, oh, this is great. Obviously, I don't think that's the only reason, but I mean, I think it helped, and so I think it tipped the scale in my favor, for sure, because obviously the program director will remember me. It's just like, oh, okay, so it's definitely more than grades, for sure.
And Dr. Simon, can we talk about recommendations? Because that's one thing I ran into with my students and the mentees that I mentor, is that, or just pre-dental students or dental students don't understand about what that means when you say recommendation. You don't get someone to recommend you that doesn't know you, that does not understand, doesn't have a relationship with you, or they may have interacted with you one time, and you don't ask somebody for a recommendation that really does not know you as the person and really have been able to be around you, see what your skills are. Because I think a lot of times the pre-dental students and dental students get that confused when you say recommendation. They think, oh, I took this perfectionist class one time, or I had an interaction with them one time, and I want to get them to write this glowing recommendation for me, and that doesn't happen. And then they get disappointed because they're not accepted, or you're asking somebody to write you something and you're not sure what they're going to write. And so I think, that's one thing that we have to stress, is that when you get someone to recommend you, they're going to recommend you because they know what your skills are, that they have been around you, they know your temperament, they know what your character is. And then when they write a red letter for you, they sign their name at the bottom of the page, that goes on who they are. And that's one thing I say that, trying to get people to understand. When you ask me to recommend you, it has to be a very, I would say a very good relationship and a very knowing relationship. And so that's why I think a lot of times students get caught up with their classes, and they're not really understanding what that means when you're asking somebody to recommend you for a position or a seat in a program.
So yeah, I would completely agree with what you're saying. So I would say, for me, I was really, I guess, cognizant of that, because I was the person that it was like, okay, I need to get to know this person. I'm like, first of all, I like what they do in the community, or I want to get to know them. Like, I was that person. I would say for the person that feels really uncomfortable, as a student, like, oh, I don't know how to approach this professor. I don't really know, like, what to do. I would say that, you really just need to step out of your, like, comfort zone, step out of the box, and, like, because it will help you. Like, if you want to learn something, and and you see this person has this skill or has something that you're striving for, you have to seek it. And so that's what it was for me. It wasn't like, okay, well, I need to get this, get to know this person, so like later on they can write me a letter of recommendation. It's really about having genuine connections, really like learning from someone, so that they see your progression, they see where you started, and now they can, they see where you ended up, and it's just like, okay, yeah, I have so much to write about this person. And I think that's really important. I think it's okay for people to, especially professors, to see your flaws. I feel like a lot of students feel like they need to go to just potential mentors is like, having everything together, and that is not true. Like, I've been through a lot with like my mentors, just like crying to them, like, just everything, to the point where they see me now and they're like, wow, like, look at what you're doing, So I think it's just important to just be who you are, like, be honest with people. I think communication is important. Be like, I like what you're doing here. I really want to get involved. Like, do you need help with anything? Like, things like that. And I mean, you can't just focus on, on your grades and just your, the classes that you're taking. You have to step out the box.
Something that I wanted to add about the letters of recommendation, I think it's important to know that for pediatric dentistry, you have to have either the pediatric department chair or program director, whoever is over the department of pediatric dentistry at your dental school, write a letter. And if you don't, then that will kind of look a little suspect, but a lot of programs require a letter from whoever holds the chair, the department chair of pediatric dentistry.
I'm definitely taking so many notes on everything you guys are saying, for myself and for, people who didn't get to listen today, just so they could reference to it if anyone is interested in pediatric dentistry, because you guys are dropping the gems right now. Dr. Lowe, did you have anything you wanted to add?
Actually, I did. Thank you so much. Good evening, everyone. I am Dr. Tantra Lowe. I am a general practitioner. My office is Awesome Smiles Dental Center, and we're located about 42 miles outside of D.C. I had 2 points I wanted to make, or actually one question I wanted to ask, and then one point. I think, Dr. Taylor, you were the person who spoke a little bit about, the psychology of being able to talk to parents and being able to answer questions and be ready for whatever and whenever it happens. And I just wanted to know if you could talk a little bit about, you and Dr. Jessica as well, talk a little bit more about, what type of personality does it take to become a pediatric dentist, so that you can deal with the parent and you can deal with the child, because it is a 2-pronged sword. It's never just the child. And so I deal with children a lot in my office, and I refer out what I need to. But I find, too, that sometimes it is so difficult to talk to the parents and to get them to understand certain things. But when you go through these pediatric programs, you learn all of these gems and all of these pearls and all of these tricks to the trade that I think are amazing, because I learn from my pediatric friends all the time. So can you talk a little bit about the psychology of what's necessary to be able to, be a fantastic pediatric dentist, to be able to talk to, again, the parents, be able to manage that child and that child's care? If you could, please. And then the second thing I just wanted to talk about will be agreeing with the fact that having a letter of recommendation that is amazing and that really, really demonstrates the type of person that you are and the character that you portray is absolutely one of the key things you want. Requires a letter of recommendation. I actually have a pre-dental program
internship program, and I read this summer one of the best letters of recommendation I've ever read out of 6 years of having my program, and it is so true. I honestly used some of his verbiage when I had to write a letter of recommendation because I wanted to make sure my student got accepted into this program. And the panelists on the floor tonight who said that. But again, if you could talk to us a little bit about the psychology of being a pediatric dentist and dealing with the parents, because it can be tough sometimes to get across what you need to get across and still manage their child's care. Thank you.
Yes, I totally agree with that statement. It can definitely be difficult. In residency, you learn a lot about behavior management. One of our attendings, we're lucky to have her. She is one of the experts on kids' behavior and behavior management and child development. And pretty much, long story short, what we have learned based on certain behaviors, how the child displays coincides with the parenting type. So being able to recognize different parenting styles and parenting types, you can kind of predict how the child will behave. But not all children are the same. Sometimes it does not follow the science. So for me, just practically what I have learned, and granted, I am a second-year resident, I have a lot more to learn, but what has worked for me is showing the parents that I'm on their side and that, I am compassionate and understanding of what they have to deal with and what they have to go through as a parent, even though I'm not a parent. So, but just being able to kind of meet them where they're at. I think that's like my biggest tool that I pull out my toolbox. Okay, you are here. You're only going to be able to, understand this or only willing to accept this. So let me meet you where you're at, because ultimately I want to do some good for the kid. I want to benefit the kid in the most way that I can. So I have run into a lot of parents that when they come to the front desk, they're like, oh, such and such is here, such and such is here. And a lot of those parents only want to see me because I have been the most understanding resident that they have encountered since they've been there. And I'm grateful for that experience. But what I have learned, like my parents that don't want any radiographs, but their kids have caries to the gum line or just different things, I tried to, meet them